Now operating in Bangladesh and Uganda, 𝗔𝗣𝗪 Labs is an extraordinary example of what can be achieved when AI-driven frugal innovation meets global health. This briefing will show how their suitcase-sized portable diagnostic units powered by solar energy and integrated with AI tools are transforming how we find and treat one of humanity's oldest diseases. Tuberculosis claims nearly 4,000 lives every day and is among the leading causes of death globally. But here's the good news: the fight against TB is already being won with the right tools. By drastically cutting the time and cost associated with testing, 𝗔𝗣𝗪 Labs accelerates treatment initiation and ensures that nobody is left behind due to a lack of access or affordability. So what makes 𝗔𝗣𝗪 Labs so special? What is their secret sauce? In short, it's the unbeatable combination of affordability, accessibility, and accuracy enabled by AI, frugal engineering. In terms of affordability, setting up a conventional TB testing infrastructure typically requires an investment of around $150,000 per lab, excluding ongoing maintenance and operational costs. This high upfront expenditure acts as a barrier, especially for low-income countries and regions disproportionately affected by TB. In contrast, a single 𝗔𝗣𝗪 lab unit costs only around $10,000. And because these labs are deployable, they can be quickly scaled to meet demand without tying up large amounts of capital. In terms of accessibility, the labs can be deployed to remote, rural, and conflict-affected areas where people have limited or no access to healthcare. They overcome geography-related barriers as well as those imposed by fragmented health systems. Many TB patients have to travel long distances and spend significant amounts of money on transportation and accommodation to reach a healthcare facility for diagnosis. 𝗔𝗣𝗪 Labs brings testing closer to where people need it, reducing financial and geographic barriers to care. And in terms of accuracy and speed, 𝗔𝗣𝗪 Labs uses advanced tools like nucleic acid amplification tests and AI-assisted image interpretation. These technologies allow the labs to deliver results in under 2 hours while maintaining diagnostic accuracy of over 90%, dramatically improving the patient experience and clinical decision-making. In contrast, traditional methods often take weeks to deliver results. Not only that, but each unit is digitally integrated, meaning that data can be sent in real time to public health authorities. This allows for effective surveillance, cloud-based patient tracking, and rapid information sharing for outbreak control and policy response. The global TB diagnostics market is currently valued at around $2.3 billion and is projected to reach $3.18 billion by 2030, growing at a compound annual growth rate of 5.8%. Within this market, the sub-niche of AI-powered frugal mobile diagnostics is forecast to grow rapidly, reaching an estimated $400 to $500 million globally by 2030. Key markets for this niche include Sub-Saharan Africa, South and Southeast Asia, Latin America, as well as conflict zones and refugee settlements. Key drivers of this growth include global initiatives such as the WHO strategy and universal health coverage programs, as well as a rising demand for decentralized and rapid diagnostics in low-resource settings. Expanding international aid and donor funding targeted at regions with a high TB burden also contribute to the growth. Additionally, there's an increasing use of AI to enhance the precision and speed of medical devices in low-power, low-cost formats. Among the top players in this space, 𝗔𝗣𝗪 Labs is currently the only company offering a complete end-to-end solution that combines mobile-first design, AI-powered diagnostics, and a deployable business model. Other niche technology players include 𝗥𝗡𝗢𝗢, Acne Biosystems, and bioMérieux SA, each offering valuable solutions, but with limitations in terms of reach, affordability, or technological sophistication. Our 5-year impact forecast for 𝗔𝗣𝗪 Labs from 2025 to 2030 under a successful scale-up scenario shows an estimated 8.5 million patients diagnosed with TB. 3 million quality-adjusted life years gain direct healthcare cost savings of $1.75 billion and economic productivity gains of $3.57 billion. These figures translate to a total societal value created of an estimated $4.8 to $5 billion. To realize this potential, we recommend 3 strategic actions. First, for investors and global health stakeholders, scale investment in mobile labs across TB endemic regions through innovative financing mechanisms such as development impact bonds, blended finance, and strategic capital. Second, policymakers should align mobile labs deployment with national TB control strategies and donor-supported health initiatives, ensuring that the labs are adequately resourced and integrated into national health information systems. Finally, outcome measurement. There's a need to develop robust real-world evidence generation protocols that track health, economic, and social outcomes at population scale. For innovators and tech developers, the focus should be on advancing AI deployment, building interoperability, supporting local ecosystems. In conclusion, Mobile Labs represents a paradigm shift in TB diagnostics, combining AI with frugal innovation to deliver equitable, fast, and cost-effective health solutions in the most challenging environments. As both a technology and service model, it holds the potential to become a cornerstone of global TB eradication strategies. Its economic impact, health equity promise, and global scalability position it as a category-defining innovator for the next decade. Thank you for watching this video. If you found it informative and would like to support our work, please consider making a donation. Your contribution will help us continue producing valuable content that informs and educates you about the latest developments in artificial intelligence and its impact on our world.